Your doctor or nurse practitioner has recommended you go for a cardiopulmonary exercise stress test. This video is designed to help prepare you for this upcoming test. Cardiopulmonary exercise stress testing, also called a stress test or a CPET, is a routine part of the cardiac rehab program. In our program, it is used for two main reasons: safety and exercise guidance. One of the most common questions or concerns people have after having a heart event is it safe for me to exercise? People are often worried about what their heart can safely handle. They may be fearful about pushing themselves too hard or causing damage. For most people, it is safer to exercise than not to exercise. It is our job to ensure that your heart responds properly to exercise and guide you about how hard you can safely push yourself. What information does a CPET provide? A cardiopulmonary exercise stress test gives your cardiac rehab team a lot of useful information. The test evaluates your heart rate, blood pressure, heart rhythm, and how your body uses oxygen during exercise. You will be wearing a heart monitor that tracks the electrical rhythm of your heart. You will have a blood pressure cuff on one arm. During the test, you will have a mouthpiece in that gives us important information about your oxygen levels and how your lungs are working. You will also wear a nose clip that gently pinches your nose closed to ensure all breathing is done through your mouth. Who is part of the test? The test is supervised by a physician. You will also see other team members during the test. An ECG technician monitors your heart rhythm. A respiratory therapist monitors the breathing component. What happens during the test? You can either walk on the treadmill or pedal a bicycle. The test starts slowly and gradually gets more difficult. For the treadmill, this means the speed will increase and the treadmill will get steeper. For the bicycle, the tension on the pedals gets more difficult over time. This will gradually make your heart work harder. It is important to remember that a CPET is a measurement of your fitness. It is not a pass or fail test. We want you to try your best and to push yourself as hard as you can during the test. Most often, you are the person who decides when you are at your maximum. You will be given instructions about how to tell the technicians when you are ready to stop the test. If there are any concerns about your heart or safety during the test, the physician or technician will stop the test and monitor you. What to do on the day of your stress test? 1. On the day of your test, please take your medications in the morning before the test. Many people are on medications that help to control their blood pressure or heart rate. 2. Eat breakfast. It is important to have enough energy to do the test. 3. Wear comfortable clothing to exercise in and comfortable footwear. 4. When you arrive, you will be given a page of information about the test and have the chance to ask any questions. 5. After you do your test, you may get some preliminary information. It can be a very busy and loud environment. You will have the chance to speak with your nurse and your kinesiologist about your test results shortly after the test, typically with a phone call. If you have questions or concerns about the test, please contact your cardiac rehab nurse. After your stress test, you will meet with your kinesiologist either in person that day or by phone or video shortly after. They will review the results of your stress test with you, and together you will create an exercise prescription that is safe and appropriate for you. Over your 6 months in the program, they will encourage you to progress your exercise over time. To get the most from your cardiac rehab program, we encourage you to think of your exercise prescription as more than a guide. We encourage you to think of it as a prescription, just like your medication prescriptions. We want you to do your exercise regularly because exercise is like a medication for your heart muscle. At the end of the cardiac rehab program, we encourage you to do another CPET. It is a great way to measure how much progress you made throughout the program. If you have any further questions about your upcoming stress test, please ask one of your cardiac rehab team members.